Gaming disorder is a particular pattern of gaming behavior, be it offline or online gaming behavior, and we are talking here about digital or video gaming, when this pattern has some very specific characteristics. One of them is impaired control over gaming. The second one is that the gaming behavior takes precedence over other daily activities and interests of a person to the extent that it results in impaired functioning or distress. And what is important that this behavior continues in spite of these negative consequences. But it's really a very small proportion of people who are involved in gaming behavior, and it's critical to emphasize that gaming disorder is not equivalent to gaming behavior. It's very different things. When the behavior is becoming dominating the whole life of a person, and that's why for particularly this is an issue for parents, for families, be attentive to how much time, in what circumstances are being spent on gaming, to what extent these gaming behaviors start to interfere with other activities, with functioning at school, at university, with functioning as a family member, as a friend, as a person with previous different interests. And in most cases, the duration of these consequences should be at least 12 months. I want to emphasize that a diagnosis of a gaming disorder can be only made by a health professional specifically trained in making such assessment. People who are engaged regularly in gaming activities need to be aware that gaming activity may not only in some individuals lead to the development of gaming disorder, but also that it may have some other negative consequences for health in terms of disturbing the sleep patterns, in terms of physical activity, because normally gaming behavior is associated with very low level of physical activities, also in terms of the nutrition. It's been included as a result of a consensus of experts who were involved in development of 11th revision of classification for mental and behavioral disorders. And the main reason for that is not only the scientific evidence available that this is becoming an issue, but also because of the demand for treatment and demand for recognition of this condition by health professionals, when there could be more research implemented, when some preventive activities could be done, and when in fact attention to this type of behavior could be devoted in terms of potential health consequences.